Hey guys, how's it going today? Mike Loria here, Resus Padawan on Twitter. I'd like to talk a little bit about on militarism today. Recently, I've done a number of podcasts and presentations on enhancing cognition and decision making. And a lot of it's borrowed from different aspects of military training that I've been through and experiences of other people in the military, and drawn on that and tried to apply it to the world of emergency medicine and critical care and resuscitation in terms of how we can make better decisions. And before I get started on talking about it, quick disclosure and disclaimer, I don't pretend to be a master resuscitationist. I'm not a physician. I'm a critical care paramedic by training, and I was a United States Air Force pararescueman, so I was a special operations medic in the military, and now just a lowly first-year medical student. I have no conflicts of interest. I don't work for any companies that sell this training or perform stress inoculation training for the military or the medical community anymore. So without further ado, one of the things that I had been talking about a lot in these podcasts and discussions and stuff that has come up is about stress inoculation and cognitive resilience, mental toughness, getting people prepared and ready to deal with the stresses of resuscitation in the hospital and out in the field, and train them appropriately. And one of the things that's come up is people have been asking me questions and have also made comments. Don't you think this is a little too militaristic? I mean, aren't we dragging some of the negative culture and military dogma into the realm of emergency medicine and critical care? And the answer is no, I really don't think so. So before I get into that discussion, I'll say if we want to talk about more about stress inoculation and cognitive resilience, awesome stuff. I think it's absolutely fascinating, and I'm going to talk more about it in the coming weeks. So stay tuned to MCRIT and I Teach EM as I have some more of these discussions and podcasts to come. Really cool stuff, and I invite you to tune in if you're interested. But for now, I'll focus on this concept of militarism or being militant. And when I think about this, I think of a very combative or aggressive posture in support of some means or end or goal, be it political or social or whatever, generally favoring some sort of extremism, violence, and very confrontational methods. And I really don't think that's it. I think that's at the heart of what's bad about some of this stuff and what is militaristic. I think it's neither intrinsically good or bad. It's just how it's applied in these different situations. So I'd like to talk about it for a second and say that what I'm really discussing here and trying to bring into the discourse in resuscitation is not necessarily militarism, but what I perceive as warriorism. A warrior is a brave or experienced soldier or fighter, right? And I think that that's what we're really looking to develop, a culture that has honor and a code of ethics and a systematic way of making ourselves better and stronger, making better decisions, becoming technically more proficient, and also allowing science and knowledge to kind of guide that as we practice evidence-based medicine, again, both inside and outside of the hospital. But one thing I think of when I think of being a warrior is this slide from wisdomofthewarrior.com, and I'll give you guys a second to read it. One of the things I like about this and liked the most was I think it really gets at the heart of the issue, which is I choose. The difference, I think, between what I'll call destructive militarism and the beneficial side of the stuff in the military is the fact that the destructive militarism is really reflexive. It's all about me and mine and my tribe, and can be very, very destructive. And at the heart of that is the battle is with others to help ourselves. So it's a matter of how we look at how we choose, how I choose to incorporate this stuff. And if it is incorporated with the goal of helping ourselves to improve the standing of our tribe, to get our agenda through, to rise the ranks and get promoted so that we make more money or gain title, control, or power. This type of militarism, this type of including these strict hierarchical structures and ordering people around and being very confrontational and abrasive, is definitely bad. I think Victoria Brazil talked about it, presented a very interesting lecture at SMAC on the tribal nature of some of what we're doing and how that can be destructive to interdepartmental or interinstitutional relationships, and ultimately bad for our patients, because that's what's at the heart of it. And that's where I really draw the line between destructive militarism and what I'll call constructive warriorism, is who it's for and who it's benefit, and what we're incorporating and the intention of how we're incorporating it. Because constructive warriorism is about improving ourselves and being strict with ourselves and battling within ourselves to improve so that we can help others and help the community, so that we can incorporate some of these lessons learned from the military to improve our decision making and cognition and ability to react or act, so that we can go out there and we can really intervene when it matters. When people are in distress and they need our help, when they are sick or critically ill or critically injured and need to be resuscitated, that we can pull in our skills and our cognitive abilities and really make a difference. Which begs the question, so there are certain elements of warriorism that seem kind of militaristic, and they are, but I think it's a matter of how we look at it. So discipline, yes, we should be disciplined, but the type of discipline should be with ourselves, be disciplined in the way we learn, to be committed to the pursuit of constantly learning new information and expanding our practice, to be disciplined and make sure we always check our equipment and make sure that we're ready to go, whether it's on an aircraft or an ambulance, in the emergency department, where have you, that we're disciplined enough to make sure that even when we're tired, even when we just want to sit there and get going, that we check everything. To be disciplined in the way we train, not to waste time, to train to 130% and really be committed to improving ourselves in that sense. Be aggressive, but don't be aggressive with other people in the sense that you being confrontational and violent, but be aggressive with your resuscitation practice, being having the courage to stand up and really get in there when you need to make a difference, when you need to perform some sort of intervention to save someone's life. Be aggressive with your care. Be combative, but be combative within yourself. Analyze your own weaks and your faults. Look at how you make decisions and look at how that can improve. Look at what you're afraid of, what your fears are, and be prepared to fight and overcome those fears. That's how I think we could be combative. I think at the heart of all this is the negative, destructive type of militarism is for the benefit of oneself, and it revolves around gross ignorance and lack of respect for other people in an attempt to better one's position or one's group position. Whereas constructive warriorism is about disciplining yourself and looking at how you can really improve yourself and improve your coworkers through skills, through training, through honing your ability to make better decisions, so that you can help other people. And that's what I think is really important. So I'd love to hear your thoughts and comments. Remember that the most powerful weapon I think we have is our mind. Follow me at Recess Padawan. Feel free to tweet me back and let me know what you think. And stay tuned to MCRIT and I Teach EM in the coming weeks for further commentary on stress inoculation training and cognitive resilience. Thanks. Bye.